Hi, this is Dr. Taryn P. Lupo, and today I'm going to talk about 5 common mistakes that your doctor could be making when addressing your thyroid problem. Stick around. There are 5 common mistakes that doctors make when addressing their thyroid patients. Now, I'm not trying to call all doctors to the carpet, but I am trying to encourage them to bring up their game. There seems to be this problem around the country where doctors are rushed and they're just not doing what they should for thyroid patients. So I'm trying to arm you with the information of 5 mistakes that these doctors commonly make. So let's start. Mistake number 1, just ordering a thyroid-stimulating hormone test, or what you commonly know it as a TSH test. Now, the thyroid is incredibly complicated, and its job is to be ultra-sensitive to the environment and make changes so your body's always stable. It's kind of like the air traffic controller of your body. It has to listen to all the signals coming in and then send signals back out telling the body what to do. Your brain ultimately sends signals down to your body, but the thyroid interprets these signals and decides what to do with them. It's a very long and complicated process, and it's a big cascade from the brain all the way down to the target cell. Just ordering a thyroid-stimulating hormone test, or a TSH test, only really tells you how well the pituitary gland and the thyroid are communicating. It'd kind of be like me taking my car into a mechanic and trying to figure out what the problem is, and all the mechanic tests is the oil. He just checks the oil and nothing else. That's what getting a TSH test and nothing else is like. Mistake number 2, not ordering a proper thyroid panel. So like we talked about in mistake 1, just ordering a TSH isn't going to cut it. You also need a lot of other tests so you can figure out exactly along this big complicated pathway what area is not functioning correctly. Here's the tests that I would recommend you order at a bare minimum. You'll want to test T4, T3, FTI, which stands for Free Thyroxine Index, T3 uptake, free T3, free T4, as well as reverse T3. Mistake number 3 is not testing for Hashimoto's thyroiditis. Hashimoto's thyroiditis is rampant in Western societies, especially here in America. Most of the hypothyroid cases have some element to this that's just not tested for or diagnosed. There's a big misconception out there that thyroid problems are caused because of a lack of iodine or tyrosine. Now, that might be true in third world countries, but in developed countries, it's not. Most people are having an autoimmune reaction to their own thyroid. It has really nothing to do with iodine or tyrosine. In fact, running around taking those supplements will actually make an autoimmune thyroid worse. Many times, the autoimmune element of the thyroid problem is never diagnosed or never even tested for because it really doesn't change the treatment plan. What's going to happen is you're still going to be diagnosed with thyroid hormones, and nothing really ever gets done about the autoimmune issue. The autoimmune issue is usually because of something in your diet that's causing the initial problem. It's very important you figure out if your thyroid problem has an autoimmune element. The 2 tests that'll tell you that are the TPO antibody test and the TG antibody test. If either of those come back positive, you've got yourself Hashimoto's thyroiditis. On a side note, you can have something called euthyroid. And what that means is that you have all the symptoms and problems of a thyroid patient, but when you do the blood work, everything comes back normal. It basically means that your blood has not gotten bad enough yet that it shows up in the testing. That's called euthyroid, so don't be surprised if you do an antibody test and it comes back negative, and then you do it again 6 months later and it comes back positive. The best way to manage this autoimmune issue is to turn down the volume of the inflammation, try to remove the triggers that you're eating, get a food sensitivity test and take the areas out that are showing up, and also switch to a plant-based diet. Mistake number 4, not testing for Graves' disease. Now, Graves' disease is the other side of the coin. It means your thyroid is going too fast. The problem I see in my office is people will come in who are diagnosed with Graves, but when you actually examine them and look at them, they don't present like a Graves patient. So something's not right. Upon further examination and blood work, what they really are on their way to Hashimoto's thyroiditis. There's a stage where the body's attacking itself, and the thyroid will create extra cells and swell. And it'll actually appear on blood work that you have a low TSH, and then it'll swing to a high TSH, and it'll swing to a low TSH, and back to a high. So during this process, if I tested you 1 month, it would appear that you have hypothyroid. If I tested you another month, it would appear you have hyperthyroid. So you could be one of these people that got tested during that speed up phase where you have hypothyroid. And if you're just basing it on TSH, you're not going to know. So if your doctor only based your Graves' disease diagnosis on a TSH, you might want to insist on getting the antibody test to confirm it. The antibody test is sometimes known as a TSI, or it could also be called a thyroid-stimulating hormone receptor antibody, depending on what lab you're using. Mistake 5, not actually doing a physical exam. Now, let's face it, your doctor is pretty much handcuffed by insurance and government insurance these days. So that means, unfortunately, you suffer that the exams get shorter and shorter and shorter. A lot of times, doctors are so pressed for time, they don't do a proper physical exam. A doctor should always put his hands on your thyroid and check to see if they feel nodules, do a proper head and neck exam to check for any signs of thyroid issues. It's very important that someone actually put their hands on and check for thyroid nodules. Just ordering a TSH without even touching a patient is just not going to cut it these days. There is also one other area that's usually overlooked, and that's to actually check the nerve flow to the thyroid. If the vertebrae that supply the nerves to the thyroid get twisted or subluxated, sometimes that nerve flow doesn't work right. So the thyroid never gets the proper nerve signal it should, and it'll malfunction. The best people that can check this out for you are chiropractors. That's their bread and butter and what they do. They'll get checked for subluxations and make sure the nerve flow is working right. Remember, you're the one that has to live with the consequences of not getting a full diagnosis. So don't feel like you're being pushy asking for these tests. This is your health you're dealing with, and you sometimes have to be proactive and take responsibility, get your way, and demand these things. I hope this video helped. Now, please remember to give it a thumbs up and share it. Also, I'd love it if you subscribe. All you have to do is click right here. You can get a lot more stories just like this about your health. Many women who have thyroid problems also have